Hi, my name is Dr. Jessica Friedman, and I am a physician and founder and president of MedEdits Medical Admissions. You can find us on the web at www.mededits.com. MedEdits assists medical school residency and fellowship applicants with all aspects of the admissions process. That includes everything from pre-medical advising to application and document preparation to interview prep, follow-up, which schools to choose. I am also the author of the recently published third edition of the MedEdits Guide to Medical School Admissions. You can find that on Amazon. Today we are going to be talking about the MMI medical school interview. The MMI was, as most of you already know, was originally developed in Canada, and the Canadians are certainly the experts in the MMI interview. The United States medical schools, both allopathic and osteopathic medical schools, are increasingly using the MMI over the traditional medical school interview. However, in our experience, we find that the MMI does vary slightly in the United States versus in Canada, simply because United States admissions officers and admissions committees are not as experienced in using the MMI as the Canadians are. So what is the MMI? The MMI is essentially a circuit type of interview or a round-robin interview. And sort of how you need to envision this is a long hallway with multiple offices, and students will rotate through each of those offices or rooms. And basically, it's like having anywhere from 8 to 10 kind of mini interviews, okay? However, the interviews are not the sort of traditional interviews the way that most of us think of them. And there are different types of MMI stations, and we will be discussing that. So you will have anywhere from 8 to 10 stations at most MMI interviews. And the entire process of the MMI will last anywhere between 70 and 100 minutes. And that seems like a long time, and it is. But you have to sort of remember that you're going to be moving from room to room, and that each of those stations is only going to be 8 to 10 minutes long. So it's a fast-paced process, and when you're in it, it doesn't feel as long as it actually is. The MMI is used to assess a bunch of sort of soft skills as well as your characteristics and qualities that traditional interviews aren't always able to kind of, get as much information about. And why is that? Traditional interviews are one-on-one. So each interviewer is going to have biases. They're going to have their subjective opinions about an applicant. And with the MMI, you have individual raters. They're not called interviewers during the MMI. Your evaluators are called your raters. So at each station, you're going to have a different rater. And this is actually a huge benefit for the applicant, because every rater is going to evaluate you independently. So if, let's say, you feel like, gosh, I really messed up at one of my stations, no big deal. You move on to the next station and you have a completely different rater. And so basically, you sort of start over with each new station. And so it really gives you many more chances to kind of impress people and make a really great impression. So there are several major types of MMI stations. So of those 8 to 10 stations in total that you have, those will consist of the following. You will either have stations that are sort of ethical scenario-based stations. So, and you will have, there are a whole bunch of ethical scenarios that MMI raters will present you with. And this is obviously a list that is endless, right? Because really in our everyday lives, we are constantly encountering basically MMI scenarios. And I really encourage my students and my applicants to think of life in that way as they start to kind of prepare for the MMI interview, just because it gets them thinking in an ethical framework. So one major type of station in the MMI is the ethical or scenario-based station. Another type of MMI station is a role-playing station, and this is, an acting station, and we will talk more about that, where you as an interviewee will ask to play the part of somebody who is counseling or interacting with an actor. And really our students and applicants love these stations. Another type of station is a task station, where you will be asked to give directions to another applicant, or you will be asked to receive directions from another applicant on completing a task. Many, many medical schools in the United States have, in addition to sort of the more traditional MMI stations, they have traditional or pathway stations. And those are kind of your more traditional types of interview questions. And this is why, the MMI interview in the US versus Canada is different from, Canada, why the US is different, because most U.S. schools do, in addition to having, sort of the ethical scenarios, the role-playing station, the task stations, most United States medical schools also give you the opportunity to kind of have a more traditional interview. You also will have the opportunity to rest during your MMI. So as a part of that circuit, you will have usually 2 rest stations where you will kind of be able to get a breather. And so that's also sort of a relief. And as I've mentioned, most U.S. medical schools have these sort of hybrid MMIs, meaning they have the ethical-based stations, they have the role-playing stations, they have task stations, but they also sort of have more traditional interview stations. So what does a typical MMI interview day look like? And obviously this is just, a representation of one medical school. Every medical school is going to structure their interview day in their own way, depending on how many applicants they have, depending on faculty availability. But, your interview day will consist of something like this. First you're going to get an introduction to the MMI. So at any medical school, they're going to assume you don't know anything about the MMI. They don't expect you to come in prepared. They don't expect you to come in knowing about medical ethics. So they're going to explain to you exactly what to expect on interview day. Where do you go? What are you going to expect? What's it going to look like? Then you're all going to gather for the MMI, all the applicants. And, and this is why sometimes thinking about your interview day is sort of more nerve-wracking than than the actual interview day itself, because once you actually get to your interview day, you're with a whole bunch of other applicants. You're all in the same boat. And inevitably there ends up being, some type of camaraderie between those applicants. And actually that's the best way to approach your interview, because it automatically makes you seem like a team player, which is one of the things you'll always be evaluated on any interview day. Then you will have your multiple mini interview. And again, this, interview typically lasts from, anywhere from 70 to 100 minutes, maybe 2 hours. It depends on how organized the medical school is, how streamlined the MMI is, and how many times for how many years have they been doing the MMI. You will always at some point get a presentation by the Dean of Admissions or the Dean of the Medical School or the Director of Admissions, where they will discuss the medical school, the curriculum, what the school's mission is, where you'll be rotating as a 3rd and 4th year medical student. And then you will typically have lunch and you'll get a tour by the current medical students, where you will learn more about the medical school and actually see where you'll be going to medical school and where you'll be rotating in your clinical rotations as a medical student. And again, there can be different variations, but these are all the major components of an MMI interview day. So what are you evaluated on during your MMI? There's so many things that you're evaluated on. You're always going to be evaluated on your communication skills and your interpersonal skills regardless of the station, okay? So these are just things that the MMI is really good at evaluating because, you're talking the whole time, you're interacting with someone the whole time, and really any interview is evaluating these 2 skills, even the traditional interview. But you're also going to be evaluated on your ethics, your morals, your ideals, how do you see situations, your cultural social competence. How understanding are you of other people? Your critical thinking skills, and how do you reason through things? How do you see situations? Your problem solving skills. Certainly your professionalism. Are you a professional? Are you someone that I can envision as a future medical student at my school? Something else that you may not necessarily be evaluated on in writing, but you're always going to be evaluated on your warmth and your approachability. And, and that's something that's so intangible that is really difficult to teach a student. But you want to be as approachable and sort of you want to convey an openness about you, during your interview, and certainly your compassion, your understanding of other people. So students are always super nervous for ethical scenarios because they think that they need to walk into these MMI interviews having a full understanding of medical ethics, and that really is not the case. The raters want to know that you can navigate a situation. They want to know that you can see all sides of a situation, and that's really key. And this is key in Casper, which a lot of people are really nervous about right now, and they don't need to be. Casper is another thing, sort of, this is just a total aside, but another, pre-screening test that you really don't need to prepare for. So if there's one thing that you remember walking into the Casper or any ethical scenario is understand all sides of the situation. Show that you can understand all sides of the situation. So no one expects you to be an expert in medical ethics. No one expects you to know, about healthcare policy, unless, of course, you're a healthcare policy expert. Okay. What I encourage people to do, there's a great website by the Kaiser Family Foundation, and the website is on the slide. And, what this foundation does is they write about all of these different issues, these current issues in medicine. And again, I don't want you reading this so you become an expert in the issues, but I sort of more want you reading this so you can kind of become fluent in the language of ethical scenarios, and that you can understand kind of what are the different sides of every situation. And that will just sort of help you to kind of be in the right mode to walk into these interviews, to kind of understand these situations that you will be presented with. They are not situations that require any type of medical knowledge. They're everyday scenarios that someone with zero medical background can navigate. So during ethical scenarios, you want to show that you have common sense, right? Students who do well on these scenarios, they have common sense. They can see things for what they are. They understand different people's perspectives, and they're honest and they're authentic, doing well in the admissions process, whether this is about writing a personal statement, or doing well in an interview. The more authentic, the more honest, the more open you are, the better you're going to do. Something else that's expected of you, and that interviewers really like to know, they want to know about your own life experiences. So, if you're presented with a scenario and you've had a life experience that kind of illustrates how you maybe navigated a similar type of conflict or, situation, they want to know about that. Now, not every scenario will you be able to infuse your own life experiences into that scenario. That's completely fine. But again, a lot of these scenarios are things that will, kind of trigger maybe other things that you've been through in your own life. And, so I kind of, letting the rater know how you have navigated similar types of situations in your own life will sort of really distinguish you. You also need to be able to justify your answer, and justify kind of why you responded, the way that you did, because your rater may follow up with questions for you. Now, they're not challenging you, because they think you're wrong. There's no right or wrong answer in the MMI. They want to see how you justify why did you take that position? And and so it's important to really kind of stand strong and be able to justify why you answered the way you did. So role-playing stations, and again, these are super fun for our applicants. And the way that this works is outside the room, you will be given a situation and you will be assigned a role. So it'll be a conflict, Joe is morbidly obese, and he's your cousin, and he says that his lifestyle just won't allow him to eat better. He says he smokes because he's super stressed, and he eats junk food because he works so much and he's always traveling. And Joe is your cousin, and he's in the room waiting for you, right? So I just made that up off the top of my head, but this is the type of scenario that you will be given for a role-playing station. And you will walk in the room, and your cousin will be waiting for you in the room. And, and then you kind of need to work through this problem with him or her. The key in these things, is always to remain calm. Don't be confrontational. These are not difficult role-playing scenarios, and just do the right thing. And and if you sort of remember that, and assuming that you're a good communicator, this is like helping your friend through a problem, or helping a family member through a problem or an issue. And again, these are not difficult stations, and they're actually our applicants find them quite enjoyable. So for task stations, and you will typically have 2 task stations, okay? So task stations are usually done, or they are almost always done in pairs. So you will be paired with another student, and for one task station, you will be asked to give the other student instructions about how to complete a task. And you will have your back to the other student, and you will know what that task is. And it can be something like building something, or drawing something, or doing some type of origami. And you need to give the student instructions on how to complete this task. These tasks are not simplistic, and they're designed that way because they're testing your patience and your ability to work as a member of a team, your ability to encourage, and your ability to kind of like not get frustrated with that person, okay? On the other side of it, you will, during another task station, you will be the one receiving directions from your co-applicant. And really, the ultimate goals of these stations are the same as they were when you were giving the instructions. So don't get frustrated. Ask questions if you have questions. And on both sides of this, it's great to be a team player, be encouraging to the other student, right? So don't see the person, let's say if you're giving the instructions, don't see your receiver as an adversary, right? You're working together on something. You're trying to accomplish this together. So show that you can do that well, because certainly this is what you'll be doing a lot of as a medical student, as a physician. Traditional or pathway stations are essentially traditional interview questions. So why do you want to be a doctor? Tell me about yourself. Where do you see yourself in the future? Why do you want to go to medical school here? So these are traditional interview questions that are very conversational. And we're going to do another presentation on the traditional medical school interview elsewhere. So how do you prepare for the MMI? Practice, right? And you don't just want to practice because you want to memorize scenarios or you want to memorize responses. Never, ever do that. Again, you will go to 10 different MMI interviews, and all the scenarios will be completely different. And that's because our lives are, essentially every day as I said at the beginning of this presentation, every day we encounter MMI scenarios in our daily lives. So, practice, just practice, not only formally sitting down with somebody and, actually being presented with a scenario, but when you encounter sort of an ethical scenario in everyday life, you read something that, as you're, scrolling through the web, or you read something in the newspaper, just think about that scenario and what are the different sides of that scenario? How would you navigate it? When you're doing your formal practice, use a timer. Get a real feeling for what does it feel like to talk for 8 minutes. Now, there will be some dialogue during your scenario as you're discussing it, but you kind of want to get a sense for what does it feel like to talk for a full 8 minutes, okay? You also really need to kind of go into your MMI understanding how it's going to feel to move from one station to the next, right? So you're going to walk into a station, the bell's going to ring, you're going to walk into the room, you're going to, do the scenario, the task, the role playing, And then after 8 minutes, you're going to walk out again, right? So when the bell rings. So as soon as that bell rings and the station is over, you need to basically clear the slate and just, forget whatever happened in that room. Walk to the next station, read whatever the scenario is on the door, and that's, how these interviews are structured. And then you need to be able to just walk in and just sort of put yourself in a different scenario, a different task, you're, a different rater. And so you need to kind of get in that mindset of what this is going to be like. Raters are supposed to be straight-faced, right? They're not supposed to show you any emotion whatsoever. However, again, we find that many raters do give students kind of, feedback in terms of their body language. Some of them say good job, but you need to go into the MMI assuming that you're going to get no feedback from your rater whatsoever, that they're going to be stone-faced, and you're going to have absolutely no clue, quote, how you did, okay? It's really important to consider what is your body language, what's your demeanor, what's your tone of voice, because even though there is less bias in the MMI because you have multiple raters, you're still going to be instantly evaluated. That's just human nature when you walk in the room. And so, do you make eye contact? Are you sort of approachable? How do you hold your hands? These are all kind of these subtleties that will sort of suggest something about who you are. So you really want to kind of, what are your expressions like? What's your tone of voice? Do you ever roll your eyes? So you really want to, carefully evaluate what your demeanor is, your body language, your facial expressions. Work with us to practice for your MMI. We have a whole library of scenarios that we practice with applicants. We also have a system of how to answer these questions, and I'll be publishing that elsewhere later on in the season. But practicing with someone who understands what the MMI is, and who knows kind of really what you need to expect during that MMI is going to help you walk into the MMI very, very confident. And that really is, kind of your ultimate goal is you want to walk into all of your medical school interviews feeling confident. You don't want to be overconfident. You don't want to be egotistical, but you do want to have an air of confidence about you. And that too kind of helps with how you are perceived by your raters. So just a little bit about MedEdits. There is no question that our students have an advantage in the medical school admissions process. All of our advisors and all of my faculty I have hired extremely carefully. We all have a minimum of 5 years of admissions experience at the faculty level. We never hire medical students. We never hire residents. We never even hire attendings who maybe have been practicing medicine for 10, 15, 20 years, but they have zero admissions experience. So we really hold our faculty to an extremely high standard. And, not just in terms of their experience in admissions, but also in terms of who they are as people. So you can be rest assured that if you do decide to work with MedEdits, that we all have the experience to guide you very, very well. We will conduct mock interviews. We help pre-medical students who want to go to medical school so they are well positioned. We will assess your candidacy. Let's say you're ready to apply next year and you're not sure if you're ready. We will tell you what we think. Are you ready to apply? Is there something you need to do to improve your candidacy so you are ready to apply? We also review documents. We edit documents, but we go really deep into those documents in terms of giving you advising within the document, making content suggestions. So it's not just a simplistic editing process. We also have professional editors who do work with us because doctors are not editors. And this is something that we really try to impress upon our students. Someone who knows how to edit a document, doctors are often not very good at that. Editors know how to edit documents. We have, I've written several books. The most recent one about medical school admissions, and again, this is a 3rd edition. I do have a traditional medical school interview book that you can find on Amazon. It has no information about the MMI, however, and I am in the process of updating that edition to include information about the MMI. And, keep an eye out for future offerings, because we are in the process of really building up our library of resources, not only for our clients, but for everybody out there. So I wish you the best of luck on your MMI interview. And if you want professional help, feel free to get in touch with us. And again, you can visit us on the web at www.mededits.com.